like to introduce Ms. Arahni Sont, who is a carer and carer representative at Carers New South Wales and a member of the NDIA National Mental Health Sector Reference Group. Arahni has worked in 5 countries in finance and marketing and is currently an advisor to Better Caring, which is a digital platform startup company where care and support workers can be hired directly. She raised her son in Mozambique until the age of 10 years and then returned to live in Australia. She has been an active carer representative since 2010, and her current roles include membership of the NDIA National Mental Health Sector Reference Group, advisor to UNSW on the development of a MOOC. Now, I actually had to ask what is a MOOC, and a MOOC, I'm told, is a massive open online course. These are kind of international online courses. UNSW has developed one at this point in time, and the first cab off the ranks is in intellectual disability. Arahni is also a member of the National Register for Mental Health Australia. And I'd like to welcome Arahni, who's going to talk on the topic of the lived experience of carers. Thank you.
Good morning, ladies and gentlemen. I just wanted to acknowledge the very informative presentation by Minister Goward, who just slipped out then, I didn't even see. And thank you, Julian, for that great introduction to the Mental Health Core Competency Framework. So, my son's name, Shai, means gift of God in Hebrew. But when I was preparing this presentation for today, I looked up on Wikipedia and saw that in Egyptian mythology, the word Shai depicted the god of fate. My son was diagnosed with global developmental delay at the age of 3 and later placed on the autism spectrum. We undertook many intensive alternative therapies in Mozambique, United States, France, South Africa, Brazil, and Australia. And aged 18, he was captain of his special school in Camden, where he was a weekly boarder. He played baseball and had a keen interest in politics and world events. As a previous financier and advisor for the World Bank, I am very analytical and I love to learn. I had read and studied widely about autism and intellectual disability, but I had no idea that there was a connection with mental illness. And then on September the 15th, 2009, our world changed dramatically when Shai, aged 18 and in year 12, in that difficult transition period, developed an initial psychotic episode. He had delusional thoughts and believed that 20 million people had seen him on the internet and were coming to get him. He thought he was famous. I had no idea what to do and where to go, and ended up in a public hospital where Shai was admitted. He remained in the hospital and later the rehab unit for 6 months. I've been asked today to speak about the negative and positive aspects of Shai's experience. On the negative side, there were a few, including the hurdles to overcome, or the barriers, as Julian referred to them. There were hurdles right from the beginning, in that the community-based acute care team did not want to assess him. After intervention from a friend who was a psychiatrist, we were referred to the local hospital. At the initial intake meeting, I remember the psychiatrist saying, "We can't cater for people like your son in this hospital." And I responded, "But where else can we go?" As a sole parent with no experience ever with mental illness, I was scared and did not feel able to care for my son alone at home. A second negative aspect were the other patients on the ward. Shai was surrounded by adults that were neurotypical, that did not have autism or an intellectual disability. In his heightened manic psychotic state, he would often annoy other patients that were already unwell themselves. Thirdly, the experience and training of the staff. There was very limited understanding of a young adult like Shai. As he started to improve, I remember having to explain what his baseline behaviour was like. I often felt he was getting better, but the clinicians and nursing staff could not really assess this, as they did not know that Shai was usually a happy, talkative person with obsessive topic fixation about baseball. On the positive side of the experience, of Shai's experience, we were very grateful. I was very grateful, he was very grateful. He was admitted and cared for in the hospital. As I later found out that many people aren't able to access appropriate care due to the shortage or demand on hospital beds and the lack of community health services. The clinical team were professional and caring, very professional and caring, and as Shai was vulnerable, he was given a special nurse. This was really appreciated and helped Shai to be and feel safer on the ward. The hospital allowed him to recover in the rehab unit, which I think only has maybe 8 or 10 beds. And in the acute unit and the rehab unit, Shai was able to access the Urban Arts-Based Art Therapy program in Double Bay, which led to him becoming a practicing artist since then. In March 2012, Shai had a second psychotic episode and was admitted again to the same hospital. This was a considerably worse experience due to a high number of adults with a drug-induced psychosis on the ward. It was very frightening for a young man, then aged 22, who never drank or took drugs. As Shai told me, "The American girl Sarah is out to get me and I'm really scared." This was not a delusion. After 3 weeks, I was able, with some difficulty, to have him transferred to the brand new St Vincent's private young adult mental health unit, now called U-Space, and he was stable after 3 weeks. At St Vincent's, he benefited from the smaller scale, 20 beds only, and the extra attention from the nursing staff, who used talking, art and creative therapies to assist his recovery. I would now like to show you a 5-minute video about Shai called 12 Goals that was filmed in 2014, and then after that I will conclude my speech.
I have a mild disability, like I have a small autism. Maybe some things I can do normal things that I can do mainstream, but I can't do mainstream like a bit longer because I couldn't handle 4 or 6 hours at uni. I only could handle 2 hours. It feels a bit strange, a little bit, but the drugs do make you eat lots of food. It's true. Mainly I take my meds from anxiety and also me not having an episode and thinking fantasy and being unwell and thinking lots of things. I've been doing the workman courier for 2 years.
Yes.
And I enjoy it, and someone who's been the longest with courier is Gladys. She's been doing 11 years of paper run.
She must be tired by now.
No.
Do you have any dogs try to attack you?
No. I haven't been attacked by a dog for 2 years, no. I feel a bit sad mostly, and I wanted to have lots of friends to come and maybe vet botany, and I like Jasper the dog. He's very nice, and I comfort him and I play with him, and Jasper's a good dog. Come here. Jasper the dog, I have some food.
Guys, eat slow.
Eat slow. Sorry.
And how long have you known Christine?
Knew her 2 years from day program at Eastern Respite when she was 19.
Would you like to get married?
No.
Yes.
No.
Yes, I would.
Would you invite Tony Abbott to your wedding?
No.
Um,
No.
yes,
No.
I would.
No.
But I'll have to tell Tony he has to be conscious about climate change and be in the environment. I was in The Black Balloon. It was a movie about autism.
And who was in this movie?
Toni Collette. I got her autograph.
Did she get yours?
No,
Why not?
because I'm not a star.
Would you like to be a star?
Yes,
Yeah?
yes. But I like to be a good artist. This is an interesting collage I made. I made all these pictures and it makes little images about what life is. And I'll be a good artist.
Tell me about the future. What do you think of the future?
I can't tell the future, but
But what do you think of the future?
it might be a bit scary. Maybe a bad one if we keep using too much water in ice in the Arctic and the water rise. We might have flooding waters in other countries and cities if we don't act. If we don't act now, we will not have a good future. That's what I say. But I wanted to have my dream to be a professional sportsman.
Alright, straight shot. Well done.
I couldn't believe how I could do 12 goals. The basketball lady of Special Olympics said I was very good and I was man of the match. Maybe I had commitment. Maybe if I could believe in myself. If I said I could do it. Everyone should have a fair go, Australian fair go.
To conclude today's presentation, approximately 1.8% of Australia's population has an intellectual disability. People with an intellectual disability experience poorer health outcomes, including higher morbidity and mortality, and increased rates of mental illness and ill health. As we have heard from Professor Troller, people with an intellectual disability are at least 2 to 3 times more likely to experience mental ill health compared with the general population. To add to this picture, 1 in 100 people in Australia now have autism, and every working hour another Australian child is diagnosed with autism. Recent studies of autism spectrum disorder have shown that 70% of the sample on the spectrum could be diagnosed with a psychiatric disorder. And other studies show that 50% of adults with autism will develop mental health issues. The increased complexity of autism adds vulnerability to a population who already face numerous challenges. I think the Intellectual Disability Mental Health Core Competencies Framework and Toolkit is a timely and very important document for mental health professionals. I'm sure it will improve workforce capacity and lead to better clinical treatment and health outcomes for people with an intellectual disability. I hope that it will be shared with your colleagues nationally and internationally. Thank you, Professor Troller, and your team for developing the framework, and thank you for this invitation to give this presentation today. Bye-bye. Thank you.
so much for sharing your story, and thank you for the privilege of introducing us to Shai. I heard Shai say, if we don't act now, we will not have a good future, and I was reminded, to paraphrase a famous quote, knowing is not enough, we must act. The framework gives us the tool to act in this area, and we must act now.